Sick children being treated in a tent is something you'd expect in an impoverished country. But it's become the new normal at Edmonton's flagship university hospital, where in the last year over 2,500 sick and injured children have been treated in a tent because facilities are so crowded. The HERT yurt, as the staff have dubbed it, was to be replaced with a permanent structure starting this month. To the Minister of Health and Wellness, why was the construction project to replace this tent with a real building cancelled?
The Honourable Minister.
Well, Mr. Speaker, as the member is well aware, we have some significant financial challenges facing the government. We have made some decisions around capital. That being said, Mr. Speaker, as we move forward in this particular budget year, we want to ensure that we are getting full value for the capital that we have allocated. I am confident and optimistic that we are going to have the opportunity to see some projects proceed that may be proceeding at a rate that is less than what we had originally estimated. And at that time, if that does occur, we will review all of our capital initiatives that, for financial reasons, weren't able to go ahead in this particular year.
The Honourable Member.
Thanks, Mr. Speaker. Well, Mr. Minister, sick children and their parents and families and an outraged staff are tired of the broken promises. How can this minister justify putting sick children in a tent while this government spends lavishly on expensive trips to Europe and drops millions on dinner parties and horse racing? Where are your priorities?
The Honourable Minister.
Mr. Speaker, I think we need to be sure that appropriate information is communicated, because there is so much incorrect information in that lead up to that question, Mr. Speaker. We have, in this particular year, this government is committing some $7 billion to capital projects across this province, Mr. Speaker. I think that on a per capita basis that is higher than anywhere else in Canada. Included in that is about $1.5 billion for health facilities. In the last 3 to 4 years, capital construction in health care has exceeded some $5 to $6 billion, and I think that's a record this government is very proud of, Mr. Speaker.
Well, the tent where sick and injured children have been treated now for over a year sits in the shadow of the Mazankowski Heart Institute. The Mazankowski, which is a year late in opening, got $36 million at the end of last year to finish office spaces, while children will be shunted to a tent for years to come. To the same minister, since when did it become acceptable in Alberta to treat sick and injured children in a tent? How did we get to this?
We have outstanding facilities in this province. I can name them all, but I think the member is well aware, and several of them in his own constituency, Mr. Speaker, to some of the leading-edge pediatric services in the world in this province, Mr. Speaker, and to suggest somehow that our children, our future, is not receiving the kind of health care that they need and desire is absolutely incorrect, Mr. Speaker.